Thank you for sticking around for our Medical Monday interview. I'm joined by Dr. Cathy Slusher, and we're talking about hysterectomies. First place to start, when do you need it?
Well, that's a very good question. Let me back up by saying, when don't you need it?
Okay.
Traditionally, if you had problems, bleeding, lesions, masses, anything, automatically you got the hysterectomy, and that's why it was the #1 operation in the country. Well, not everybody needs it, because we do have different modalities that are very minor, such as ablations and things like that. So everything that bleeds or everything that has a mass doesn't necessarily need a hysterectomy. But if you've gone through the workup and that is determined that you need a hysterectomy, the next question is, with all the forefront of minimally invasive surgery is,
Right.
Can I have that? Because obviously the recovery is quicker. Surgery is always surgery. It takes you down. You have to recover from it. Whether it's minimally invasive or traditional surgery, it all requires recovery. So you never walk into the surgery as though it's a no big deal. If it's on you, it's a big deal. If it's on me, it's a real big deal.
Yeah.
So, that's the real take-home message. But minimally invasive surgery, laparoscopic hysterectomies, and if you leave the cervix in, that's even more minimally invasive. If you
Okay.
take it out, it's a little bit more of an operation. The old traditional total vaginal hysterectomy is still considered a lesser invasive hysterectomy. Those do recover quicker. And let's jump to the other side of the coin, and that's where you open the abdomen and do the full-scale old-fashioned hysterectomy.
Right.
Those still have a very, very strong place. When fibroids are very large, when there's an ovarian mass that you're evaluating that could possibly be a cancer or not, if there's a lot of old disease that you have scar tissue there, or a previous surgery has been done that determines there's a lot of scar tissue, that operation is still very important. But if you've gone through the workup and had a laparoscopy or an ultrasound or some form of testing that shows that everything's pretty normal, but you're still having the problem and the uterus needs to go because you've explored your other opportunities and they're not there for you, then a minimally invasive technique, which is a laparoscopic procedure or a vaginal procedure, may be the way to go, and may, in the long term, simplify what's going on with your life, because these problems that we as women experience can be very major and can be very much a deterrent to your quality of life. And so, you don't need to live with it forever. You do need to go ahead often and take the next step, or take the plunge, if you will. But it is important to ask the question, am I a candidate for this? What's your best recommendation to your physician, to your surgeon? Which operation is best for me? What would you offer me? And if somebody says you're not a candidate for minimally invasive, there's always people who are going to offer you whatever you want to hear.
Okay.
You got to be cautious and do the right operation for the right disease process.
And you were saying surgery is surgery, then recovery time is always going to be the same. Err on the side of caution would be the advice.
Absolutely.
Okay.
And ask questions. Don't walk into it blindly. Know that it's a big deal because it's happening to you, and make sure you know what you're doing and why you're doing it.
Okay, very good advice. Thank you for joining me. Really appreciate it. Dr. Cathy Slusher can be reached at that phone number right there, 540-434-3831.